because they're told that they should get one every year.
Right, well, the standard of care, because I am a medical doctor, the standard of care is to get mammography, okay? Now, the new information, it's not that new actually, but the information is saying if you get routine mammography, you're probably 25% increased risk of cancer. So I do everything on an individual basis. I do not do one size fits all for any patient. Every individual is an original, so you can't treat every single patient the same, and every single treatment and recommendations are not going to be the same. But mammogram can have potential danger because they're carcinogenic. They're radiation.
Right.
Just like CT scans, just like PET scans. If you do any kind of scanning, you must do protection, which we'll talk about in a second. You must do body cellular protection if you're going to get those scans, which is what I do on every single patient. Now, the other thing you can do is we were talking yesterday about bioenergetic testing. Bioenergetic testing, we all have a vital loop. Yes, you see Dr. Pomp, a 3D physical, but if you looked at every single one of his trillions of cells resonate with this beautiful bioelectromagnetic energy. And all the cells resonate differently, okay? They all have this beautiful photonic light that exudes, okay? So the new field in the United States, now it's not new because in Europe they've been doing it a long time. Actually in the United States we've been doing it probably over 30 years now. And it's assessing the biofield. Just like very much like an EKG. An EKG, when you go to the doctor and get an EKG, it's an electrical energy assessment of your heart. It tells me, oh, is his heart working or not? Is it showing any kind of variations, okay? And it may be normal, but he still may have heart problems, okay? So then there's something called the quantitative EEG of your brain. It actually checks the measurements of all your lobes, okay? And it says what's in balance and what's out of balance. And then we know how to fix it. Well, we can check the whole body now doing bioenergetic testing.
And you do that in your clinic?
Yes, we do it in our clinic. We've been doing it. I've been doing it personally on myself because I'm so into cancer prevention because of my own issues. And so I've been doing it for about 20 years, and I learned from a mentor. But this has been around since 1940. Yeah. And so it's not it's new, but now, as you know, everything gets better.
Yeah,
everything gets better, and it's more fine-tuned. So we have all of these options to know before you see it on ultrasound, before you see it on a scan. Don't wait, because the cure for cancer is prevention. Thank you. The cure for cancer is prevention.
Hey, I got that one right. All right. So yeah, I mean, and that's really important here. It's the message that's so important that everyone goes, yeah. Okay, yeah, let's go on now. Tell me what I need to do if I have cancer. All right, well, let's talk about that. So let's talk about some of the things that you're doing that are really different. Okay. I believe we should prevent. That is the most important. Okay, but now I have concerns. I was diagnosed with these bad cells, or whatever cancer diagnosis you may have had. What do you do, and what are you doing that's different?
Right, first of
and
all,
we're not telling you to replace your treatments, right? Because a lot of these things go right along with it even.
Right, well sometimes, okay, the conventional treatments for cancer are surgery, chemo, or radiation, or some combination thereof. And I will tell you, sometimes people need surgery.
Absolutely.
Sometimes people need chemotherapy, and radiation I'll reserve. So anyway, with that said, so if you have a lump or bump, remember, that's just the top of the iceberg. And I just tell people, if you need surgery or chemo, you need me, because I'm going to protect you through the process. Plus, I'm going to get you well from head to toe, whether it's emotional, whether it's eating, whether it's purification, whether it's your sleep, whatever it's, you're fixing your nutrient, maybe it's fixing your gut, maybe it's fixing whatever, okay? And then if you do surgery, think about it. Surgery is an invasive, injurious, inflammatory, immunocompromising process. So even if I have a patient who comes in for a facelift, they go, Dr. Connealy, I need a pre-op for a facelift. And I go, okay, well guess what? We're not only gonna do a pre-op, we are going to prepare you for this surgery so that you heal beautifully. So I have my patients do hyperbaric oxygen, IV vitamin C. I have a whole nutritional protocol to prepare them for not only facelift surgery, but for cancer surgery. Because sometimes people need to have surgery, okay, unfortunately. because tumors are immunosuppressive.
Yeah.
So sometimes you have to, or maybe sometimes the tumor is impeding with your intestines or some anatomical part of your body. Then there's chemotherapy. So chemotherapy we've been doing for 50, 60 years. Well, Nixon declared war on cancer in 1970. Now, we have not made any advancements in cancer in the success since the war on it. So now we need to say, time out. Okay, we need to probably look at things differently. We need to integrate the surgery and chemo with all of these other lifestyle interventions, whether it's like we talked about, whether it's dealing with the emotions. So when I have a patient that comes in, I do all their blood work, okay? Then, and I tell them first and foremost, you gotta relax. You have this diagnosis. You can't unring the bell. Do not become your diagnosis. Do
That's
not
very
own
important.
the diagnosis.
Very important.
Don't
Thoughts?
become the label. Don't. This is an episode of life that you're learning, okay? And you're learning about, and now you are going to now get the microscope out and look at everything you do. And there's no way that I can tell you in 1 or 2 visits everything I know. So that means you're gonna have to go and do lots of research. And if things sound the same on many places that you read, then there must be some validity and truth to it,